Part of the job of the Medicare Local is to find out what's working and what's not working in the community and who is missing out on important health services. Taking the pulse is one of our ways of finding out who's missing out, and also hearing solutions directly from community members themselves to how people can get access to the services they need. So we have done a lot of work with data and looking at a whole range of statistics, but we know that they don't tell the full story. And it's only when you get out and about and start talking directly to community members that we learn what's important and that we hear some new ideas and some new solutions to health problems.
Well, sharing information, you often don't feel you need the information until you really need it. And there's been so much, particularly in the newspapers and reports, and even the Weekend Australian stopped having a health section in the last month or so, and I think people like to be well informed.
When English is not the first language, it's harder to understand things, and I guess that's one of the things that I've been through myself. Even though now I'm pretty okay with English, but at the beginning it wasn't really the case, and probably as well a lack of vocabulary, and that makes things worse when if you get sick or you're stressed under a particular situation. I guess it's good to know where to go.
Well, the Medicare Local is meant to be exactly that, local. So we have a region. It is 870 or so thousand people, and there are lots of very different places. So to get an understanding of local needs, we need to talk to local people in local places. So we're going to 8 different locations around the region, some of them in the city suburbs of Brisbane, where there's a real mix of very well-off people and homeless people living side by side, through to rural communities where there's a whole range of different issues at play. And we really need to talk to people so that we understand all of that diversity in our region.
So I guess it's just, yeah, I think that's a really important thing, and being here, learning something, passing information, and probably providing to you not only my experience, probably what I've seen, and how could that help you, I guess, to deliver something better for an inclusive community, because obviously as well I'm aware that I'm not the only community that exists, so I guess there's a lot of other people that have different backgrounds, education, and things that will obviously go through the system as well. And yeah, I think that's a really important step to take into account the community.
People will start to hear that they can make a difference in their own lives, and that our role will be to support people to make a difference in their lives and the lives of their families and the lives of their communities. Health is a very broad concept. Having good health is not simply about preventing illness, it's also about a whole range of things that you can do in terms of your own sense of identity, a sense of belonging, and a sense of ability to change things and to interact with what's going on in your environment. So I guess we really hope that people get a sense of their own ability to make changes in their personal lives and to contribute to their communities to make the broader community more healthy. Obviously we can do things to support them, but a lot of this is actually about communities taking control, and we want to support them doing that.
Well, I think it's very good. I'm very impressed with the turn-up of different people from different countries too, which is not easy to get people to come, you know, sometimes. But they've been encouraging each other. There is a table that know each other, and yeah, I think it's very good indeed. It's very good. I'm impressed. I had a little, you know, look at what they're promoting, because really, yeah, it's no point spending lots of money on medicine if you don't make the effort to be happy in your life.